Welcome to True Health Tuesday, and the truth will set you free. Welcome, comrades. We're in California. Okay, I got to tell you, last week, I've been doing this every week for multiple years. There was one time 7 years ago that I couldn't speak. I was yelling and screaming, had laryngitis. Last week, I was at death's door. I mean, it just hit me like a ton of bricks. I could barely stand up, and people are saying, "Gee, doc, you look like you've been breathing." Yeah, no kidding. I start here at 5 o'clock in the morning. I don't have a break. I've been working 6-7 days a week. So, that kind of stuff will weaken your immune system. I'm going to go over the details of how fast a human being can recover. Except I used DMSO, which is orally. I've used it topically in the past, and chlorine dioxide, which I've never used to recover and build an immune system. But we'll cover all of those things later, and which is because, frankly, with the government partnering with Facebook and things, the censorship is through the roof now. And neither one of those things I think you can mention because that's what we'll be using in the FEMA camp. Okay, so all the censored and non-censored info will be available on the Dr. B VIP. Please, for goodness sake, thank you everybody who's supporting that. But get on there, copy the stuff, look at the websites, share it, spread it, look at the handouts, everything. And Extreme Health Academy. I mean, you're talking just brilliant people there. I'm going to do a 2.5-hour seminar this coming, or hopefully 2 hours, but this coming Sunday. So it's something that we got to get together. This is one of the few forums that we can get together that's uncensorable, that we could talk about cures and therapies that are not approved by the religious fervor of the medical system. Peripheral neuropathy. Peripheral means away from the center. Okay. But, let's just look at this, because one of the things that's mystifying is that we still use a lot of Latin terms, in anatomy and physiology. It's to separate us learned folk from you regular people. Okay, but I tend to say a Latin term and then a regular term. Just basic common sense. And the tough part is medical doctors and chiropractors and homeopaths and naturopaths, we're all learning the same stuff. Okay, the problem is the therapies are different. So if you're in an industry that's the medical industry, you're trained by the pharmaceutical, you're funded by the pharmaceutical industry. So your solutions are going to be pharmaceutical based. I mean, that's just it. Now, if you think that just about every joint in the body is two bones coming together, surrounded by a joint capsule, and inside of that joint capsule is a fluid that's a superfiltrate blood. So all the joints are hydraulic, Just think of that, So if you have a problem with the blood, they're going to desiccate or dry up. If you have altered blood supply or nerve supply or altered mechanics, those are the only three things that can go wrong. Otherwise, a joint is continually being regenerated. Now, in my world, in the chiropractic world, even though 86% of all the chiropractic colleges are being taken over by the pharmaceutical industry, I look at the blood supply, the nerve supply, and the biomechanics for a reason that gives the symptoms. Go on, say, duh. Whereas in other professions, they'll look at somebody that's 40, 50 years old, that's a contractor with, joint pain, back pain, or anything. Well, yeah, it should be sore, you use it. No, we've got one patient who's got 5 Super Bowl rings. He's in his early 60s, jogs every day. His hips are perfect. There's nothing wrong with it, and nobody uses those hips more than this guy does, So the joints are designed to last for the full 120 years that we're going to be here, But they will start to give you a symptom if you alter blood supply and nerve supply. Now, in Crazy Stupid World, you'll take this joint that gives you a symptom that tells you it has altered blood supply, nerve supply, or altered mechanics, And you'll take, oh, I don't know, what do you think? Altered, like a non-steroidal anti-inflammatory, ibuprofen, Advil, Motrin, Aleve. God knows how Tylenol works, but you can take that. That destroys the building blocks of cartilage in that joint. Okay? It destroys proteoglycan production. I mean, that doesn't make any sense. So let's look at this. Now, peripheral neuropathy can affect the body and it can affect the organs. Okay, soma is called the body, viscera is called the organs. Now, electrical burning, sharp, and shooting, those are all nerve pinch pains. So when people come in and say, man, it's burning right through here. It's burning right on the bottom of my foot. I know what's causing that. That's a nerve problem. Okay, so it's real simple when people are going to tell you. And that's what some of my instructors would say. They said to find out what's wrong, you got to do two things. Ask the patient and listen. Okay, so motor weakness, proprioception, dropping, okay, picking up stuff and not having the strength to hold it. Sexual dysfunction, cardiac issues, lung issues, all of those could be from some compromised nerve supply from the viscera too. When we look at this, and this is just a quick summary of what nerves are, or language is. Neuro means nerve, patho means suffering, ology is study, osis means condition of, itis means inflammation, toxin is poison. So then you got neurotoxin, neurology, neuropathy, and neuritis. Okay, so if somebody says, I have diverticulitis, that means an outpouch in the intestinal tract that's inflamed. I have diverticulosis. That means an outpouch in the intestinal tract that's a condition of, it's not really bugging you. Okay, so let's break it down and demystify it. It's not a thing, I have neuritis. Okay, yeah, nerve inflammation. Okay, good. Inflammation is how the body heals. So what's causing it? No, all these symptoms, okay, are governed by this nervous system, the autonomic or automatic nervous system. If you have physical, chemical, or emotional stress, the sympathetic fires off, and the sympathetic nervous system is located in the mid-back, thoracic area and top of the lumbar. The parasympathetic is the rest, digest, or repair. And this is located in the neck and the low back. And sure enough, just had a patient today. He had, honest to goodness, you're going to see this. If you're chiropractors in the field, you're going, yeah, I've seen that before. Okay, high blood pressure, type 2 diabetes, and high cholesterol. Did he have good digestion or poor digestion? Survey says poor. Yeah, no kidding. And I come in, I sit down, and I'm getting old and crotchety, okay? And so I say, well, you don't have high blood pressure, type 2 diabetes, or elevations in cholesterol, you have stress. And he says, what do you mean? I said, well, okay, if I stand on your foot, will your blood pressure go up? I don't know. Okay, I'm going to stand on your foot. No, doc, it'll go up. So it's kind of foolish to understand that you have those stressors and aren't addressing the cause. And that just doesn't make any sense, but that's the medical world. So we got to look at the cause of this. Okay, now, obviously there's diseases and stuff like type 2 diabetes. Okay, that 95% is type 2, and that's a blood poisoning. Hansen's disease or leprosy, vitamin deficiency, medications, trauma. That makes sense. So if you bang somebody and knock a joint out of place, can you take a medication so it moves that bone back into place? No, you got to fix it. Okay. Alcohol consumption, immune infections. Okay, so now this is kind of cool. This is how you find out where the site of the lesion is without doing any nerve tests. Now, I can still draw brachial plexus from memory. Okay. Doc, can you do it? Okay. Yeah, I was a little nuts. I was one of those nerd guys. But it's called 5363 many, and that's how many you got: the roots, trunks, branches, divisions. And if you pinch the 6th cervical nerve, it affects these 2 fingers. And that's right at the nerve root. But if you have the 6th cervical nerve connected to the 7th cervical nerve and a little bit of the 8th, you're going to have the median nerve. You can have the radial nerve. It's a little bit lower, and that'll have a different distribution. Okay, so it's going to tell you whether the nerve is right next to the spine, so it's more of a disc injury, or a little bit away from the spine, so it's more somebody hitting you in the shoulder with a baseball bat. Hopefully nobody have, but we've seen that. And people will literally tell you. I had a guy today that says, "Yeah, doc, got this burning pain, electrical burning, sharp and shooting, nerve pain, right? Okay, going right down the side of the leg. Okay, and I know what that is. That's myalgia paresthetic. It's the branch off the first lumbar nerve." And he looks at me like, "Yeah, right. Okay, guess where he had the disc injury?" Okay, it's kind of cool. But you'll see this. People will literally tell you, and they won't show you it hurts here. They'll describe the pain like this, okay, where it radiates. Now, to differentiate peripheral neuropathy or nerve compression from a joint issue, joints don't radiate. They don't go away from it. And think of like a wheel where the radiating spikes, okay, the radials. So if you have a joint pain, it's going to hurt at the joint. If somebody says, "Yeah, man, my doctor said I got a torn rotator cuff and it hurts just like this," you got more than that, buddy. Okay, you got a pinched nerve in the neck. Okay, and that's what they're going to say. So it's pretty easy. So peripheral neuropathy, mechanical distortion. I mean, here's a patient that came in last week. A reverse curve in the neck, multiple rotational malpositions, and again, systemic peripheral neuropathy. She had all this other stuff. Can you fix a mechanical distortion with a medication? No, there's no drug that'll fix it. And that's why you're looking at the majority of the doctors out there are trying to approach this with the wrong tools. You need tires, go to the muffler shop. Okay. So now when you're identifying disc injuries, okay, so you got a proximal lesion thinking that, it's going right here, right down. Okay, that's L1. This is L2. This is L3. Okay, so, you're going to identify it just because you know anatomy. But when you take this spine, the person's standing up and you bend it, the discs should open the way you would think they would open. Okay, where they're narrow on the concavity, wide on the convexity, and they should open like that. If you get a disc that's wide on the inside, okay, and narrow on the outside, that's abhorrent. It's not working correctly. Does that make sense? Am I going too fast? No, it's basic common sense. Okay, now you can't identify a disc on an MRI because the position will change the biomechanics, and then people will say, "Well, do a weight-bearing MRI." Okay, why not just do a stress X-ray? It's really clear. It shows really nicely. Okay, and then this is an abortion. I mean, the surgeon here should have been run out of town on a rail, tarred and feathered, like we should do to Newsom, okay, in September. Okay, but Sarah, can we do that anymore? Okay, I guess not. Okay, so this, he bolted the lumbar to the sacrum. Now, when a barbarian does this, you completely alter the mechanics. So the rest of this guy, the rest of the time he's on this planet, he's got to move his legs in a different fashion because the sacrum is now completely unstable. Okay, I mean, that's just barbarian. But this guy ended up having 3 discs above the surgery site. So you got to look at, even though you got a disc injury and your doctor, who's the best doctor, okay, yeah, there's anybody in here ever see the 3rd best orthopedic surgeon? Have you ever even heard of the 3rd best? I know you have. He's good looking, but not real talented. Okay. I know, think how stupid that is. Everyone's the best. But you got to identify but look at more than just the site of pain. If you got forward head carriage or lateral translation of the thoracic area, it's just not going to ever get better. Now, all joints are hydraulic. They have fluid going to them, okay? And it's a superfiltrated blood. That's the beauty of a knee. When you walk, your knee joint swings in the air, okay, creating a negative pressure. Then you stand on it and it compresses down. It's amazing. It's a pumping action just walking across. No wonder we can walk for 100 miles. But these are 3 different samples of blood, and all from the same family. It was kind of fun for me. The 18-year-old, the red blood cells, that's close to normal. Okay, they're still starting to clump together. The 64-year-old had the best blood, but of course, does the 64-year-old get regular flu shots? No. Any medications? No. Eats healthy? Yes. Okay. The 44-year-old, that's a nightmare. Those worms are supposed to be separate red blood cells. The only difference now is, and we're going to do this probably next week on the version that can't be censored. Okay, is you're going to see what happens with the current jab in the blood. It's just mind blowing. So, the health of the blood, is that important for the health of the joints? Absolutely. I just put this guy up here because he's cool. Okay. A lion trainer from Dubai came in a few years ago and he's limping because he has, sciatic nerve, which is a lumbar issue, an unstable pelvis. There's going to be components of the rib cage area, thoracic. He had a reverse curve in the neck. And he said, Doc, you got 2 weeks to fix me because if my lions see me limping, they'll kill me out of respect and love. Obviously, you wouldn't want to live with that limp. Holy moly. Yeah, he's still doing good, thank God. Okay, but this, remember, physical, chemical, emotional stress. Okay, this is a physical stressor. I mean, football injury from when the gal was back playing hockey, field hockey or something. Okay, but under chronic pain, what happens to blood pressure? It goes up. Okay, now your liver is going to start to break glycogen and glucose because you're in a stressed state, so blood sugar is going to go up. Now they were on 2 blood pressure medications. Now, when you are under stress, good blood supply to the gut or poor blood supply to the gut? Poor. So they're given an antacid. Now, even though antacids decrease the mineral absorption and causes cardiac arrhythmias, and for every 1 blood pressure drug you take, your risk of stroke increases because your blood pressure's got to be here. You decrease the blood pressure with a drug, your arteries are going to constrict. So that's why if you're taking a blood pressure drug, the constriction of the artery increases strokes. So if you take 2 blood pressure drugs, that's devastating. So we said, look, for goodness sake, okay, just separate your drugs, okay, by at least a half hour to an hour. That way you lessen your risk of stroke. And we're going to get you out of the pain. And you're going to be okay. So what kind of drugs cause neuropathy? Because remember, we got 2 professions. One profession's looking for the cause. The other one's looking for the pharmaceutical intervention. Drugs against arrhythmias. Okay, cancer, antibiotics, alcoholism treatment, high blood pressure drugs. Whoa, interesting. High blood pressure drugs cause neuropathy. Psychiatric drugs, depression. Well, we'll get a lot of those in the FEMA camps. Seizure drugs, anti-rejection, dermatitis. I mean, virtually everything, okay, can cause damage because remember, we've got this blood. And if you're taking a toxin that alters, because all drugs alter a metabolic process, they slow or stop a metabolic process. Now, imagine if you had an entire profession governed by an industry, okay? And I'm talking like, I don't know, maybe the CDC, the HHS. These are not independent government agencies. They have massive, massive involvement in the pharmaceutical industry. All of the medical schools, that they don't have independent research, okay? So all of this is funded by it. Now, here's the Journal of Law and Medicine Ethics. Institutional corruption of pharmaceuticals and the myth of safe and effective drugs. Where have you heard that term, safe and effective? Yes, I know it's experimental, never been used on humans before, but it's safe and effective. What data do you have for that? None. There's no long-term studies, but it's safe and effective. Okay, yes, okay. Over the past 35 years, patients have largely suffered from hidden epidemic of side effects from the drugs that usually have few offsetting benefits. The pharmaceutical industry has corrupted the practice of medicine through its influence over what drugs are developed and how they are tested and how medical knowledge is created. Since 1906, heavy commercial influence has compromised congressional legislation to protect the public from unsafe drugs. Congressional legislation. Does the government work for you? Should they? Are they supposed to? So they are our employees. So if we see a problem, we have to grow testicles or ovaries. God knows what the pronoun people are looking for, okay? But you got to grow something so that we can go in there and say, hey, look, you guys are our employees. You're of the people, by the people, for the people. You're not doing your job. Okay, so diabetic neuropathy. Now, a nerve has two things. It can go on or off. That's it. Okay, so it's called an action potential. So it has to have enough stimulus to where it goes off. Now, if you have, and nerves are electrical, but they're also chemical. So if you have thick blood there, or blood that's not healthy, okay, in its design, this is where the peripheral neuropathies or diabetic neuropathies can come into. And diabetes, 95% of type 2 of diabetics are type 2. Now, this is a blood poisoning. Now, if you take a medication, because remember, a medical world is not going to look at why you have that neuropathy. They're going to, because, the neurologist that's going to look at the neuropathy is not talking to the endocrinologist. Hell, he doesn't even like that guy. Okay. Okay. So they're not going to say, hey, look, maybe this diabetic neuropathy is actually coming from some of the medications you're taking, or maybe it's coming from a stress response. Maybe we should solve that in order to correct the neuropathy. Do you think that conversation ever takes place? Hell no. Okay, not in our system. It's just you got billable hours, baby. You bill that sucker. Because now, if you take a drug to lower it, like metformin or glucophage, you lower blood sugar 9%, you have a 19% increase in death. That's foolishness. You lower it in 14%, you get a 43% increase in death. Okay? And no one's going after the cause. Because type 2 diabetes isn't from lack of metformin in your diet. It's not from enough glucophage. You got to get that drug. I mean, that's just foolishness. Cholesterol drugs, which cholesterol is 50% of your overall weight of the brain. Cholesterol is the main precursor to virtually every hormone you make, every glucocorticosteroid, mineralocorticosteroid, sex hormone, everything. And if your cholesterol is high, it means you're under stress. I got an idea. Take a drug. Okay? Except if you lower it, your type 2 diabetes goes up. Okay? I mean, it's like foolishness. So how about, I know this guy's crazy. He should be banned. I'm sure he is, I mean, Dr. Seuss and Dr. Gabriel Cousins, good God. Green eggs and ham and curing diabetes. Watch his video if it's still up, okay? Called, what was it? Simply Rock, okay? Fantastic. Takes a few diabetics, some type 2, some type 1, changes their diet, and within 1 week, they're all off their medications, okay? And at the end of it, even when type 1 gets cured. So what are the solutions to neuropathy? I should just put one point up here. Find the problem, okay? That's it. Okay, so you do get your nervous system checked. If you're taking drugs that are, because remember, all drugs slow or stop a metabolic process, find out why you're taking them. Identify the physical, chemical, or emotional stressors. It seems too simple, but that's actually the truth. If you have stenosis, which is a narrowing of the spine, and you want to see this? This is a normal curve in the neck. This is a whiplash trauma causing stenosis. How do you correct the stenosis? Restore the curve and then regenerate the disc. Wow. None of this like, I have stenosis. It runs in my family. No. I mean, you remember Charlton Heston talking to the burning bush? Okay, the burning bush gave him some great information. He didn't say stenosis runs in your family. Okay. Now, DMSO, I'm not going to recommend this or go over the details of how to use it, but this was amazing. Since a friend gave it to me, and I've been taking it every day for about a week, since last week, I've noticed increased energy, decreased joint pain, everything. There's a couple of books that I wanted to put in here, but one of them is DMSO for Doctors. It's the handbook. And I would totally recommend you looking into this. Now, it's a byproduct of the paper making industry. What's interesting is drugs.com listed that it helps bladders, okay, bladder inflammation. I mean, they're injecting it, doing IVs. I wouldn't recommend that yet. Okay, maybe later. But even the DMSO reduces joint inflammation, blocks pain receptors, which I wouldn't recommend because pain receptors are telling you there's a problem. reduces inflammation, swelling, allows the sufferer to start activities. Okay, just know that it has an antioxidant property. So we're going to do a whole different thing on this, okay, where we can detail out what the DMSO actually does. But it's one of those things like chlorine dioxide that is going to be prohibitive because it's a, substance that works. Oh man, when I started this 20 years ago, there's no way I would. No, no, no. It's in America. We can do this. Okay, forward head carriage. Okay, we got to talk when we're talking about neuropathy, because a friend up next to the boat had this radiating pain coming down to her finger, radiating pain, and they said it was a shoulder problem. Okay, bullshit. Okay, so we know it wasn't the shoulder. Okay, we know it was coming from the neck. Did she have forward head carriage? Absolutely, you could see it there. Now the Mayo Clinic said a forward hunch posture can cause these tendons to become pinched, eventually lead to a tear, rotator cuff, serious injuries, pain, weakness, limited daily activities. So that forward head carriage in the neck is 93% of all headaches. Okay, this is carpal tunnel syndrome, rotator cuff problems, everything. So you got the mechanical distortion causing a peripheral neuropathy. And why? Because you out to the thorax here, if your head goes forward, you're choking off the blood supply and nerve supply to the arm, the whole upper extremity. Now, and I got to talk about rotator cuffs because this irritates the heck out of me. It's so easy to fix rotator cuffs. You got 4 muscles that connect this humerus, okay, into the socket. If any of those muscles get weak, it does not fall out of the socket, it falls up. So you get impingement syndrome. What happens if you do a rotator cuff repair without correcting the causative problem? Okay, let me word this in English. We know that most rotator cuff problems have to do with the head being forward. So if the head's forward, you got compromised blood supply and nerve supply going to the joint. If you have compromised blood supply and nerve supply going to the joint and decide to operate on it, do you think it will heal good or poorly? Duh. Gosh. For goodness sake, no kidding. Up to 90% of rotator cuff repairs re-tear. Why do you think? Okay, because they're not looking at the normal biomechanics. Labrum, and people will come in because they love their doctor. Why? Because he's the best. Not your third best. Okay, he's the best. Okay, so he comes in and they'll say, yeah, I got a labral tear. And I'll say, well, is it alive or dead tissue? Well, I don't know, doc. They said it's torn. Yeah, you approximate it, you bring it together, it heals. It's amazing. Okay, it works really, really well. Now understand that if you have a superior displaced, okay, a labral tear, it always goes up. So that means you can carry stuff here. You go like that, it hurts. The worst exercise that you could possibly do with a shoulder rotator cuff injury is to do elevation exercises. The worst exercise ever. What's the number one exercise that people are doing when they do a shoulder? Is crank it up. Why? Because it's already up here. So what we do, we actually drop the shoulder down, reform the labrum using a simple thing. You got to restore the nerve supply, and by God, it heals. We'll do heat on the joint. That helps too. Replacement shoulders, I wouldn't recommend. So far, 23 years of doing this, I haven't recommended one shoulder replacement. We've always been able to repair them. Carpal tunnel syndrome. This is hugely important. Again, neuropathy. Okay, you got a forearm. You got muscles on this side, muscles on this side. These are called flexors. These are called extensors. The strength ratio is 5-4. They should be almost the same strength. If you have a problem with the neck, typically the extensors are going to get weaker. And so that creates a muscle imbalance, flattening out the tunnel. Okay, and so we use very expensive things like wrist resistance extension devices. It's a number 32 rubber band. Okay, now pay attention. I won't shoot you. Okay, I was a paper boy for the Herald Examiner. I could kill flies with those suckers. Okay, and then we have a roll of 29-cent electric tape. The reason electric tape's so good is because it doesn't stick to the fur. And you could just put your thumb and pinky together and put it around the metatarsals, okay, or metacarpals, and stabilize it. And it just maintains the integrity of the tunnel. It's fantastic. When you're looking at neuropathy, okay, just had a kid patient today, ear infections. Ear infections after his mom was given Pitocin after birth, and now he is around 15 years old, okay, with skin disorders. Why? Because you can have pinched nerves in the neck, you can have reverse curves in the neck, you can have all this trauma from the medical interventions and the normal birth process. Even birth process is traumatic regularly. But you get somebody, initiating Pitocin in there that causes uterine contractions. It's horrible. Here's a Marine. This is, again, you can see the humerus on the one that says damaged. That's a bony outcropping growing down below. Why? Because his shoulder was superior displaced. It wasn't in the socket. So the body's laying down extra bone down below. Okay, so we were able to help him drop it down in place. But this is a really bitchin' tough guy. I mean, he's out in the field. The fact that our government now doesn't appreciate the military drives me nuts, okay? Because we're close to Camp Pendleton, and these guys are just warriors and healers. I mean, multiple explosions. He's in the bomb disposal unit. God bless him. This is my son. God bless him too. That's what a shoulder dislocation looks like. Has no bearing on this conversation, but I just thought you'd like to see a shoulder dislocation. It's kind of cool, okay? And when we talk about correction, literally, this is some of the exercises that we tell people to do. If you have loss of curve, I mean, if you're going like this, put your elbows on a counter, put your fingers like that, lift up, and you have this radiating pain, don't do it. Okay, wait till you get it checked by a corrective chiropractor, somebody that's going to take an x-ray and do some therapies and take another x-ray to show he's corrected it. Beautiful. But just getting that curve back in the system will really help correct the forward head carriage and most of the peripheral neuropathies that you could possibly have. Does that make sense? Okay, find the problem and fix it. Now, I put this stuff up at the end of each talk, okay, to make you understand that most of these conditions, they're adaptations to physical, chemical, or emotional stress. So what do you got to check for peripheral neuropathies? The nerve supply, to correct it, regular exercise, healthy nutrition to get the blood working good, sleep, because that's when your body regenerates, and prayer and meditation, because your emotional components have a lot to do with how you heal. Okay. What if I said inflammatory bowel disease? What if I said headaches, migraine? You find the source of the problem. It's all the same. So now, and so everybody on YouTube and Facebook, we're going into the world of censorship, okay, where only those with courage to learn things that your government doesn't think it's appropriate for you to learn. So come with me, if you dare.